In 1972, the Board of Regents of the University of Texas established the Health Science Center at Houston. They envisioned an institution which would become one of the nation's outstanding university biomedical centers, developed upon the strong foundations already laid by the University of Texas units based in Houston. The University of Texas units, which were already in the Texas Medical Center, included the dental branch, established in 1905 as the Texas Dental College, and joining the university system in 1943. The Division of Continuing Education, established in 1948 as the Postgraduate School of Medicine. The Speech and Hearing Institute, established in 1951 as the Speech and Hearing Center and joining the university system in 1971. The Graduate School of Biomedical Sciences, established in 1963. The School of Public Health in 1967. And the Medical School in 1970. This diverse group was joined by the School of Nursing in 1972 and the School of Allied Health Sciences in 1973. Collectively, they form the largest single institution in the Texas Medical Center. The Health Science Center at Houston, in its complexity and diversity, represents a major resource for the state of Texas and is one of the few health science centers in the country with such a wide range of programs and activities. In its early years, the Health Science Center had several presidents. Acting President Dr. John Victor Olson, who was Dean of the Dental Branch for 30 years, Dr. Charles Berry, and Acting President Dr. Truman G. Blocker, Jr., who was President Emeritus of the University of Texas Medical Branch at Galveston. For almost 10 years, the maturation of the Health Science Center was guided by Dr. Roger J. Bulger, whose tenure from 1978 to 1987 saw both the Health Science Center's enrollment and faculty increase over 20%. Private giving increased from $2 million to $8 million annually. Annual research expenditures increased from $8 million to $35 million, and the annual budget increased from $72 to $218 million. Most importantly, Dr. Bulger evolved a management style emphasizing a sense of mission with an interdisciplinary approach to health-related activities, Health Science Center-wide participation in the planning process, and through establishment of the Health Science Center Board composed of the deans and vice presidents, participation in decision-making and policy setting. The Interfaculty Council and Student Intercouncil Dr. Bulger established also linked to the board. Under the guidance of Interim President Dr. John Ribble, Dean of the Medical School, these management perspectives and structures continue to serve the Health Science Center as exemplified by the Strategic Planning Committee, drawn from a campus-wide representation, providing an ongoing planning entity. The goal of the Health Science Center, as defined in the mission statement, is to improve the health of the people through the education and training of health professionals and biomedical scientists, and through scientific discovery and the application of new knowledge and technology for the prevention and treatment of disease and the enhancement of the quality of life in the multicultural society of Texas. The mission statement serves as the ultimate arbiter of our course of action and forms the cornerstone of strategic planning. The Health Science Center's growth toward accomplishing these goals is manifested in the three areas: education and training, research, and service, patient care and public health initiatives. In achievement of a primary goal in the mission statement, the Health Science Center at Houston educates and trains health professionals and biomedical scientists. Enrollment for the Health Science Center is over 2,800 students, not including fellows and postdoctoral researchers in residency programs. Training of health professionals is enhanced by our 148 formal affiliation agreements with major hospitals, city and neighborhood clinics, senior citizen centers, public schools, and others. More than 450 medical school house staff train at affiliated hospitals, including Hermann Hospital, our primary teaching hospital. The faculty in the Health Science Center are committed to excellence in education. Teaching incentives are built into tenure criteria, and careful teacher evaluation processes exist in each school. Additionally, teaching awards, such as the McGovern and Freeman Awards, stimulate excellence. The Health Science Center actively recruits strong academicians. However, attracting and retaining first-class faculty is a challenge in our highly competitive environment. 10 years ago, our faculty salaries were not on a par with other UT components. Moreover, the Consumer Price Index for the greater Houston area rose from 65.9% in 1978 to 110.39% in 1988, a 67.4% increase. Fortunately, the Health Science Center has been able to respond, increasing average state-funded faculty salaries from just over $31,000 to approximately $60,000 today. In addition to education and training of students, research and the application of new knowledge conducted by the brightest minds must also be a primary objective of the Health Science Center. Cumulative direct research expenditures for the Health Science Center in 1987-88 were in excess of $35 million, an increase of 438% over our 1978-79 levels, and a 22% increase over the previous year alone. The Health Science Center has become increasingly successful in competing for NIH grants. In fiscal 1987, the Health Science Center was awarded over $25 million, including indirect costs, ranking 53rd of 456 institutions of higher education competing for these awards. The Institute of Technology Development and Assessment, bringing the expertise of our faculty to the corporate environment, continues to evolve, engaged in multiple projects. The Health Science Center also pursues its mission goals through service, direct patient care, and public health initiatives. In 1987-88, the 290 medical school clinical faculty accounted for 55% of all patient admissions to Hermann Hospital, and more than 231,000 patient visits in ambulatory care clinics. Revenues generated by the medical practice plan, including contractual income, have grown from $14 million in 78-79 to over $50 million in fiscal 87-88. One important new contractual agreement calls for the UT Medical School Department of Psychiatry to provide the medical leadership and expertise for the new Harris County Psychiatric Center, which opened in October 1986. Dental branch clinics continue to serve the community and the state with special emphasis on aid to the medically indigent, handicapped, and other underserved segments of the population. Almost 79,000 patient visits were recorded in the main clinic in 1987-88, and over 22,000 in the outreach clinics, such as Goodwill Industries, University Children's Hospital, and the Laredo Webb County Health Department. These services generated almost $1 million in patient revenues. Through programs supported by United Way, the Speech and Hearing Institute provides comprehensive evaluation and treatment services, recording in 1987-88 21,000 patient visits and over $800,000 in revenues. The Health Science Center's School of Public Health, the only one in the state of Texas, recently participated in the implementation and evaluation of the state's indigent care legislation, has developed the Texas Health Care Information System, and is involved in a wide range of service activities which benefit the Health Science Center, the community, the state, and the nation. Computerized nutrition education modules developed by Allied Health Sciences Nutrition and Dietetics program are now available for public use. And the School of Nursing faculty serve in staff or consultant positions with nursing homes, hospitals, clinics and psychiatric facilities, and social service organizations throughout the community and the state of Texas. In other areas of service through direct patient care, the Health Science Center will seek increased funding to extend and expand its involvement. The Health Science Center's Valley Border Project will improve health services to an underserved population, and through educational and research-based programs, assist the region in achieving self-sufficiency in healthcare delivery and manpower development. And in a major development, the medical school will expand its academic and clinical programs in a public setting, entering into a joint contract with Baylor College of Medicine to provide patient care at the Harris County Hospital District's new North-Northeast General Hospital. While the Health Science Center's location in the Texas Medical Center is universally recognized as a major strength, the Health Science Center's non-contiguous physical facilities pose a formidable challenge in integration and coordination. To efficiently manage the Health Science Center's operations, over 2 million square feet of floor space in several different buildings have been effectively linked into one institution through the imaginative application of state-of-the-art communications and information systems. Via UT-TV Houston's television cable broadband system, the Health Science Center at any terminal in its institutions now provides, in addition to management computer systems, access to the world-famous collection of the Texas Medical Center Library. To carry out the mission of the Health Science Center in times of economic flux, support services management approaches have become increasingly resourceful. In managing human resources, our most important asset, automation and implementation of computer systems has enabled the same number of staff employees to handle a much greater volume of work, avoiding the need to increase staff in most areas. A remarkable facility at the Operations Center building has significantly upgraded training and development of employees, with an annual average of over 3,000 employees trained in supervisory management workshops, computer systems, and technical classes. Over the last 10 years, Health Science Center management has taken the posture that service departments, such as building and construction, vehicle maintenance, and printing services, should be self-supporting and not subsidized by state dollars. Their pricing structure should be competitive relative to outside vendors and should include long-range plans for capital asset replacement. The Medical Service Research and Development Plan, MSRDP, which manages the business activities of the clinical faculty, truly reflects this management philosophy. Like any good business, it stands on its own. All costs are borne by the practice plan through its revenues. In the last 10 years, MSRDP has become a dynamic example of how management has implemented computerization. In 1979, a study indicated management systems in MSRDP, budget, accounting, and payroll were antiquated. In December 1980, the MSRDP operations were centralized using new software. During the first year of full operation, collections increased by 60%. Today, MSRDP performs valuable centralized billing and collection services. While a patient may visit several of the 13 departmental clinics staffed by the Health Science Center, the patient will receive only one bill. And even without a badly needed ambulatory care facility, MSRDP activities, which provided a large amount of uncompensated care, generated $50 million in income in fiscal 1987-88, an amount sufficient to pay all practice plan costs. In September 1983, a customized, virtually paperless, online, interactive financial management system known as 2FIMS replaced the antiquated accounting system. 2FIMS, developed by Health Science Center personnel in cooperation with its software vendor, is fund-based, supports full compliance with generally accepted accounting principles, and has a number of Texas-specific features. Through a licensing agreement, 2FIMS is made available to other UT system components and other public institutions in the state without payment of the licensing fee, which could result in savings of over $600,000 per institution. Royalties from international sales of a modified version have provided over $600,000 in income, much of which has been used to develop and enhance software systems. Also being developed in the same manner is the Student Information System. Sales of SIS should provide a significant source of royalty income as the system is marketed throughout North America. The Budget Payroll Personnel System, which will be linked to 2FIMS, is scheduled for implementation in early 1989 and focuses on management of data relating to our human resources. The Health Science Center is also particularly proud of its auxiliary enterprises, centrally managed and completely self-supporting. Modern facilities and exemplary service programs in student housing, the Recreation Center, and the Child Development Center enhance the quality of life of the students, faculty, and staff of the Health Science Center. Like other institutions, the Health Science Center has not remained isolated from the economic trends experienced by the state. General Revenue Fund appropriations are now 41% of the total operating budget, as opposed to 60% 10 years ago. The Health Science Center has become increasingly innovative in restructuring operations to cut costs or maintain costs at the current level and establishing mechanisms for generating additional local income. Several cost avoidance measures were instituted in the 88-89 biennium. Building maintenance and equipment purchases, which could be deferred, were held in abeyance. Relocation of service centers from lease space to the university-owned Operations Center building represents annual savings of $445,000. A proposed upgrading of the existing mainframe computer was eliminated by adding an electronic direct access storage, additional memory, and tuning of existing software. This approach saved $300,000. The Health Science Center negotiated a 5% rate reduction in the cost of chilled water and steam provided by the Texas Energy Cooperative, TECO. Annual savings of $350,000. The Health Science Center contracted with a travel agency to provide on-campus services at guaranteed lowest available rates, which produced annual savings of $70,000. The Health Science Center continues to explore other cooperative efforts with the MD Anderson Cancer Center through the Houston Interinstitutional Coordination Committee. The consolidation of printing services with MD Anderson Cancer Center will save approximately $100,000 per year. Long-range planning has taken on an increasingly corporate style as well. The Health Science Center is implementing a modified zero-based budget. Instead of using the previous budgets as a starting point for planning, each budgeting entity will be required to justify its current level of spending, as well as any additional funds it may request. In the area of salary administration, management's posture is that salary adjustments should be performance-based. Accordingly, through increased departmental budget flexibility, the Health Science Center has extended to the departments the option to provide salary increases to meritorious employees within the constraints of their budgets. Health Science Center management also has recommended a bonus proposal, which views bonuses as one-time combination reward incentives, which would not result in increasing the salary base. A major tenet of the Health Science Center long-range budget structure is that increased development activities must play a significant part in funding. Development Board advisory committees have been linked to particular schools to enhance interactions. Annual fundraising efforts support student assistance funds, research support funds, the Dean's Excellence Funds, and the Health Science Center's advancement funds. A strong program of charitable giving through life insurance has been instituted to maximize the impact of planned giving. The UT Lifetime Health Letter and UT-TV Houston's many excellent educational broadcasts increase the visibility of the Health Science Center within the community and the state, contributing to the success of development efforts. In 1987, the independent consulting firm of Pete Marwick, Main & Company conducted an important study of the Health Science Center's economic impact on both the greater Houston area and the state. In terms of overall economic impact, the study determined that each state-appropriated dollar coming to the Health Science Center resulted in a statewide economic impact of $7.43. In an even more direct return, economic activity generated by the Health Science Center at Houston generates substantial revenues for state and local governments. In fiscal 85-86, these approximated $17.2 million, equaling 19% of the general funds appropriated for that same period. One of the firm's most important findings quantifies the value added by graduate education received at the Health Science Center at Houston. For 1985-86 graduates alone, the predicted career earning power of Health Science Center graduates was enhanced by $574 million. Finally, the Health Science Center provides uncompensated health care and related services to the community. In fiscal 85-86, these services were valued at over $37.5 million, realized in savings to the public on indigent care financing and reflected in a healthier, more productive population in the community and the state of Texas. Planning and direction for the Health Science Center is provided for through the strategic planning process and articulated in the volumes comprising the 6-year strategic plan, whose major emphasis in fiscal 1990-95 include non-capital program changes, enhancement of academic support services, development of faculty and faculty research activities, expansion of the Health Science Center's academic program, enhancement of curricula, development of research centers and institutes, expansion of community service in greater Houston area communities and in Rio Grande Valley U.S.-Mexico border communities, enhancement of computer capabilities, and of administrative services. Priority capital needs include an interdisciplinary ambulatory care facility, a School of Nursing, School of Allied Health Sciences building, and an education and research building for the medical school at the North-Northeast Hospital. 29% of total funds required for non-capital program changes will be sought through state appropriations. Federal contracts, grants, and development funds are possible sources for the remaining 71%. Funding for capital changes will be requested from the Permanent University Fund, 82%, and the balance from other sources. The Texas Constitution prohibits the use of general revenue funds by the UT system for construction of buildings, major repairs, rehabilitation, or land acquisition, except by extraordinary vote. The Health Science Center has matured into a well-respected institution with major accomplishments in the education of health professionals, in the advancement of scientific and health research, and in the provision of health care services. Its many contributions made over the past 10 years exemplify the University of Texas Health Science Center at Houston's unyielding commitment to serving the community and to improving the health of the people.